And I call the member for Warringah.
Thank you, Madam Deputy Speaker. Today I rise to speak on the Aged Care Bill 2024. Australia's aged care system is facing a crisis. It's unsustainable and not effectively meeting the needs of our older Australians. With an ageing population, demand for care services is only going to grow, making it crucial that we develop a system that promotes the wellbeing of older people while remaining economically sustainable. In the next 40 years, the number of Australians over the age of 65 is expected to double, and those over 85 are expected to triple. In Warringah, nearly 17% of the population is over 65, with over 25,000 individuals entering their senior years. These numbers highlight the growing demand for aged care services, particularly the increasing desire for independence and support to age at home. The Aged Care Bill 2024 is an important piece of legislation aiming to deliver significant reforms that ensure quality of care for older Australians. It also seeks to help seniors maintain their independence, especially through ageing at home. My electorate in Warringah and my electorate office regularly receives calls from constituents who need assistance navigating the complex aged care system. And it's not just those needing it themselves, it's often family members find it incredibly complex. The current system is clearly not meeting the needs of the community, and that's why I welcome the reforms. There has been long delays and difficulty in getting the level of care needed by people. The Royal Commission into Aged Care Quality and Safety revealed hard truths about our system and horrendous stories of neglect. The final report, titled Care, Dignity and Respect, made 148 recommendations for improving the standard of care. Following the report, there have already been 3 legislative changes, and now this new bill responds to about 60 of the Royal Commission's recommendations, alongside with those made by the Aged Care Task Force. This bill will replace the Aged Care Act of 1997 and the Aged Care Quality and Safety Commission Act of 2018. The new legislation gives the Aged Care Quality and Safety Commission increased regulatory powers, as recommended by the Royal Commission. It introduces a new regulatory model focused on ensuring that registered providers offer high-quality care while being held accountable. And that is the most important part that we often get feedback from the community, is how do you know the facility you're proposing to send have your loved one live in is actually going to meet their needs. Accountability and oversight are essential in delivering better care, and I support the introduction of a statement of rights for older people in this legislation. Placing the rights of older people at the centre of the law is a necessary step to recognise and protect their dignity. However, I am very concerned, and alongside key stakeholders, how are those rights going to be enforceable? And there seems to have been a watering down of the initial intention when it came to that statement of rights to where it now sits. And when I've visited and discussed this with constituents, many have concerns that that a statement of rights for older people not just be window dressing, that it actually be effective and have some effect in relation to the standard of care and treatment they receive. The Support at Home program, which would come into effect on 1 July 2025, is also another key change in this legislation. It will replace the current 4 Commonwealth home support packages, and so those 4 will become 8 ongoing classifications, and there will be 2 additional short-term classifications, one for restorative care and one for end-of-life palliative care. And I welcome these changes. They aim to better support older Australians in ageing at home, meeting their changing or developing needs, and ensuring they maintain their independence. And of course, the additional short-term classification, restorative care, means assist people in meeting short-term increased needs. And the sad aspect of the palliative care one is, of course, at end of life, that assistance that can make such a difference to the quality of life and supporting of the person and their family through that difficult time. I would note, though, whilst they're good, these changes, they do very little to address the age discrimination and the huge gap that remains between services, between the NDIS and the aged care. It remains that those over 65 that develop or have an accident or develop a disability, they still cannot access a similar level of support and assistance as those under 65 under the NDIS. There is still a massive difference between the maximum level of support in these 8 aged care classifications and even with the additional restorative care aspect or home improvements compared to what is available under NDIS. And keeping in mind that 65, many in this place are at that age threshold, is not, whilst traditionally thought of as a time of slowing down and maybe retirement, many people are incredibly active at 65 and still contributing, working and very active. And if an event occurs that significantly changes that situation, it's still such an incredible contrast that just because of that age threshold, the difference in dignity and support that people will receive is still incredible. And it is still an age discrimination that needs to be addressed. Essential feature of the Support at Home program is the no worse off principle. It's designed to provide continuity and certainty for those already in the aged care system. Because of course these are big changes and people have contacted my office concerned about what does it mean for them if they're already in the system. The program also introduces a new assessment tool allowing for more tailored support, and I welcome that, but again, the proof will be in the pudding in terms of how that assessment occurs and making sure that it is not just an automated, overly administrative process, but that it genuinely is flexible and recognises individualised needs of people. One of the key aims of the Support at Home program is a reduction in average wait times for care approval and access to services to 3 months. It's a significant improvement compared to current approval wait times of some 12 months or more. And that delay is devastating because for families, we've had instances where some people have passed away while they're still waiting for their care approval. So I think it's incredibly important that when we're looking at this type of service, that the administrative side of it is effective and efficient, that it's well resourced to make sure there is no delays in wait time. I welcome the government's intention to reduce these wait times, but I do have questions about how they plan to implement the ambitious reduction. So if we've got circumstances going from over 12 months to now it's going to be done within 3 months, you have to question just how. So I hope this is going to be done sensibly and efficiently. I am also concerned about the measures that will be in place to ensure that people are not neglected or forgotten about during those wait times. So even if they are reduced to 3 months, a person's condition can significantly deteriorate in that time, and obviously a lack of support or their need can make a significant difference. The new funding model requires older Australians to contribute more to their care costs, and I know that's of great concern to some, in both the Support at Home care model and the residential care. Now, we know that for this to remain sustainable with an ageing population, that contribution is necessary. The fees will be based on services used, with full pensioners making low contributions for some aspects of care. Part pensioners and Commonwealth senior health card holders will contribute depending on their income and assets, and self-funded retirees will face higher contributions. The changes to the residential care will include increased contributions to daily living costs and reforms to accommodation contributions. Both the residential care and support at home care will be categorised into clinical care, independence services and everyday living care. In terms of financial contribution, the clinical care will be fully funded by government and funded for everyone. The second category, the independent services, such as personal care, will require contributions. And these will range from 5% for pensioners to some 50% for self-funded retirees. Everyday living services, the third category, and that can include things like cooking and cleaning, will require the highest contributions, from 17.5% for full pensioners to 80% for self-funded retirees. Now, I welcome that contributions will have a lifetime caps and aim to create cost parity between home care and residential care. So, needless to say, these costs arrangements and contribution arrangements are complex, but I do commend the Minister and her team for the diligence in working this out. And I note that the bill has been referred to the Community Affairs Legislation Committee for review, and that will hopefully provide a careful analysis of its economic impact and the viability of this structure. And for my constituents, we will endeavour to have more information as much as possible and ensure that people are engaging with these changes and understand how to properly access the services and what these contribution models mean for them. Our older Australians deserve to live with dignity, and the new aged care bill represents a positive step in addressing the challenges we face as a nation with an ageing population. However, much more needs to be done to ensure that all Australians receive the care and support they need in their senior years. I should note I recently visited the St David's village in Frenchs Forest to hear concerns from residents there. And the recurring theme was the desire for agency. Older Australians want to maintain control over their lives with autonomy in their services, independence in their living arrangements, and choice as well in end-of-life care. Another key concern was how the government plans to communicate the changes, what transition provisions will be in place, and how it plans to support people through these upcoming reforms. Ensuring older people maintain agency during this transition is crucial. To help seniors, their families and the communities navigate the aged care system, my office, as many other MPs, but in particular, I recently released a seniors guide to assist in organising aged care. What was interesting is so many of the services are digital, right? They're online. But for many people, that is incredibly complex, and they just need a proper hard copy, a roadmap to using these services. So the Seniors Guide has been an incredible success, demonstrating the importance of providing accessible information for informed decision-making. So much of the key information of aged care is assessed online via an online portal. And by making this information available in a simple printed booklet, we've received huge feedback and appreciation from the senior community because it does make it a lot easier to navigate. And so I encourage the government to be mindful of, whilst we want the efficiencies of everything being online and digital, we do need to be mindful that that remained accessible for all. Lastly, I'd like to mention that when considering changes to aged care and how to improve that quality of care, we need to consider how these changes will impact First Nations Australians. The National Aboriginal and Torres Strait Islander Ageing and Aged Care Council is working to better ensure that aged care policies are culturally safe and trauma-aware for elders. Now, it's a massive issue that for older First Nations Australia, the concept or the prospect of residential care brings back a huge amount of trauma, especially if they are part of the stolen generation. And so we have to make sure that throughout this system and throughout legislation, we acknowledge the complexity and the challenge that First Nations Australians face. The Council has made a submission on the bill to the Senate Community Affairs Legislation Committee and makes key recommendations.
A division has been called for in the House.